Good afternoon, and thanks for joining us for today's Healthline 3. I'm Johnette Magner. Here we like to focus on ways to live a healthier, happier, and pain-free life. Now, we're going to be taking your calls and answering your questions live in the studio today. We will be opening the phone lines, but as a reminder, please make sure you are in a quiet room when you call with your TV turned all the way down. Our number is 318-219-4569. So today's topic is outpatient hip and knee replacements. My guest today is Dr. John Mays. He is an orthopedic surgeon with Willis Knighton Bossier Orthopedics. Welcome.
Thank you, Jeanette.
Why don't we begin by talking about hip and knee replacements? What exactly is a hip replacement?
Hip replacement is for people who have arthritis in their hip. That can be rheumatoid arthritis, osteoarthritis. There's a million different types of arthritis. You can even have a congenital deformity, like if you were born with an abnormal hip, or you can have a fracture, so that would be post-traumatic arthritis. There's a number of reasons why people have damage to their joints that results in weakness and pain. Far and away, the most common cause people seek us out for a joint replacement is because of pain. So if you just can't walk and you can't stand and you can't do your daily activities, typically people who have new onset hip pain are going to have pain in their groin, in their upper thigh. Sometimes it does radiate down to the knee. They're going to have difficulty putting their shoe on, putting their sock on, getting up off of a low like a toilet. They're going to have pain if you're in church or you're in a movie and you stand up. It's going to be stiff, and those first few steps are going to be very painful. We call that startup pain. After you get going, it may get better, but those initial steps are going to be the worst. And when you have pain like that, and it limits you and it prevents you from walking around the block or going to activities, playing golf, playing tennis, at that point it's time to go see somebody and get it addressed. In the old days, we used to tell people, don't do anything until you just can't stand it anymore. Mm-hmm. So people would often suffer until they could barely walk, or they would go years limiting their activity, or maybe even using a cane or using a walker. The reason we did that was because the technology was not as good as it is today. A hip replacement or a knee replacement was a much more complicated and dangerous surgery. Today, I wouldn't say they're completely routine, but they're much more standard than they used to be. We have technology now, we have medications, we have robotics, we have AI, we have computers, we have multiple techniques, even with our anesthesia colleagues, to make the surgery almost easy. I tell people, do not dread it, because it's going to be way easier than you think. The biggest complaint I have from people after a hip or knee replacement is they come back and they say, I should have done this years ago. And I encourage people, don't suffer. Now, I'm not saying first time your hip and knee hurts, go get a joint replacement, but certainly get it checked out and understand what the options are before you make decisions that it's too much or I don't want to do that. Maybe you just don't really have all the data yet.
And a total knee replacement, same sort of thing with the knee?
Same thing. If you look at statistics, knees are about 3 times more common than hips. Hips are less common. And people typically think that a hip replacement is bigger surgery than a knee replacement. In reality, a hip surgery is way easier to get over, quicker recovery, better long-term results than even a knee replacement. So a hip replacements, they're about equal as far as how extensive they are, but as far as recovery, if I had to have a joint replacement done, I would want a hip replacement because it's that much easier and quicker. But they're less common. We do them less commonly than we do knees.
I would have never guessed that. I would have guessed the opposite, that a knee replacement is easier to recover from. And why is that so?
The knee is a much more complicated joint than the hip. The hip is a ball and a socket. A knee is a sliding, rotating hinge. Much more complicated, much more 3D activities going on. When you do a hip, it's much easier to get it balanced, to get it correct. A knee is more complicated. If you look at a knee replacement, it's an easier surgery to do, but it's a harder surgery to do right so that it feels normal. So after a hip replacement, over 80% of people forget they have it. So we call that the forgotten hip. That's our goal, to do a hip replacement and have somebody forget they even have a hip replacement. And that's achievable in most cases. In a knee replacement, it's much more difficult. Even though the knee replacement is better than the arthritic, painful knee, it's hard to achieve a knee replacement that feels like an 18-year-old normal knee, because it's just a more complicated joint. The overall balance and the way you do them is more complicated. And that's where robotics and AI really come into play. It's much more useful on knees than it is for hips.
Are knee replacements more common just because they get more wear and tear?
Yeah, if you look at statistics, each year in the United States, there's about 1.3 million knee replacements done, and there's there's about 500,000 or so hip replacements. So it's more than twice as many knee replacements, and both the knee and the hip see a lot of wear and tear. So 4 times your body weight goes through your hip and your knee every step you take. So one of the major issues we deal with in the United States is the obesity epidemic. We have an epidemic of obesity, and people come to me all the time and they say, you know, did this cause my arthritis? Did I get arthritis because I'm obese? And I say, no, you did not, because osteoarthritis, which is far and away the most common type of arthritis, is not caused by obesity, but it's like throwing gasoline on a fire. So if you have arthritis and you're obese, it's going to cause it to progress much faster. So we certainly focus on weight loss, exercise, but obesity, and people come in all the time and they say, I walked too much, or I stood too much, or I ran too much, and I, quote, wore out my knees. It doesn't work like that.
Okay.
No, it's not wear and tear. In fact, walking and exercise protects your joints. If you look at studies on marathon runners, they have a way lower risk of arthritis than people who don't run. So running and activity and exercise is protective.
Even when it's serious, hard exercise, like a marathon.
Right.
Okay, all right. Well, we have a caller. Welcome to the show, Ann. What is your question for our doctor?
Good morning, both of you. I have a question in regards to a knee replacement. I had a knee replacement done back in 2013. Both my knees were really, really bad, but I had one knee done and the other one seemed to be fine. So the doctor said that did the replacement that it will only last about 10 years. And so I'm wondering, I don't seem to need to have that done right now.
Well,
but I'm wondering if I need to do another one now. It's been more than 10 years.
No, I don't know what doctor told you that, but that's really, really, really old data. If you look at knee replacements done in the last 10 to 15, even 20 years, they're lasting over 30 years. So, and the majority of them are going to last forever. So typically when we do joint replacement now, we tell people this is going to be a permanent joint unless something significant happens. I mean, you can of course fracture it, get an infection. I mean, you can damage them, but if you have a knee replacement that was done in 2013 and you're still doing fine, it's most likely going to last the rest of your life.
Oh, great. So how would I be able to know you said there are different types of material used now? How will I be able to know that what was used for me back then is one of the better ones?
Well, if it's still working and you're happy with it, then it's obviously doing pretty
good,
well.
huh?
But realistically, our recommendation at this time is that you should see a doctor and get an x-ray every 2 years if you have a joint replacement, just to check up on it, make sure it's doing okay. So even if your doctor who did your surgery is not around anymore or from another state, you could call up anyone and go get checked, because you do need to get the joint examined with an x-ray every couple of years.
Okay. I haven't been doing that. I don't remember being told that. If I had been, I think I would have, because I'm a go to the doctor type of person and make sure. Now, the exercises that I do, sometimes like it just swell up, and I have a ace band that I put on it, and it feels like it's out of socket, and I start to exercise and then put that band on it, and it gets better. Is that an indication that something could be wrong?
If it's getting progressively worse, if it's been like that the entire time, it could be stable. But if you notice that your activity tolerance has gone down, or it's swelling more, or you're having pain or discomfort, if it's been 13 years since your knee replacement was done, you definitely need to go get an x-ray and get it checked. Because there are some things that are only going to show up on an x-ray.
Okay. All right, I can do that.
Go see a doctor. Come see me.
I will. Come see you. I'll do that.
All right.
Thank you very much.
Thank you.
And you have a good day. You too.
Thank you so much, Ann. She has some great questions.
She did. She's an experienced user.
So we have another caller. Lonnie, welcome to the program. What is your question for our doctor?
Well, I had my knees and hips done. I've had my knees and hips done, and my fiance had one hip done, and it went good. But the other hip ran into a lot of trouble, and still having trouble today after 2 years. And just wanted to ask the doctor what to do about that.
So she had a hip replacement 2 years ago and continues to have pain or problems with it?
No. She had a bad infection in there, and then you went in there and you put a spacer in there, and then after that, you just kind of released her.
Well, if somebody has, obviously with any joint replacement, one of the major devastating complications that we worry about is an infection. They're very rare, but they do occur about 1 in every 50 joint replacements. And if you do get a hip replacement and it gets infected, we do oftentimes have to go back in, take out the implants, put an antibiotic spacer in for typically anywhere from 6 to 12 weeks until the infection is completely cleared, and then put a new hip replacement in. So if she still has an antibiotic spacer in there from 2 years ago, then she definitely needs to go see her doctor, get it evaluated. There are very rare cases where someone, for whatever reason, just cannot clear an infection. Typically what we'll do is we'll send those people to see what's called an infectious disease doctor, and they will treat them with antibiotics, get the infection eradicated, and then we'll go back and put the hip replacement in there. So I'm not exactly sure why she's 2 years now and still has an antibiotic spacer, but that's something to discuss with your physician.
To another doctor, they put another spacer in there, and then they put a hip back in there, and she's slowly getting better now.
Right.
But
Well,
you would I don't know. You just released her.
I did.
Yes, sir. Matter of fact, you recommended her see a foot doctor.
Yeah,
you
well,
referred her to a foot doctor.
I've never released anybody with an antibiotic spacer. I don't know exactly what you're talking about. I mean, I could have referred her to another physician, but that's never happened.
Mm-hmm. Okay. I appreciate it. Thank you.
All
Thank
right.
you.
Thank you so much for your call. So he raised an interesting question. He said he's had both his hips and both his knees. Do you often see people who need hips and knees? Because the very things that have caused the hip problems end up causing knee problems?
Absolutely. You know, osteoarthritis, rheumatoid arthritis, lupus, gout, psoriatic arthritis, they typically affect all the joints. So it usually starts out with a knee, one hip, one knee, but then years later, maybe 6 months later, we end up doing multiple joints. So we definitely have some patients where we've done all of their joints, and it happens quite often.
All right, well, we have another caller. Carl, welcome to the program. What is your question for our doctor, please?
Hello, thank you very much. Good morning.
Good morning.
Afternoon, my bad. I just had my hip replaced, doctor, around after 2 years ago? And I feel great, fantastic. The doctor that did mine, he said it's new technology. But my question is, what are the safest ways for me to stretch my hip without risking damages? Because this is the way I damage it by stretching.
Well, typically stretching is not going to damage your hip. If you had a hip replacement that was done with modern techniques 2 years ago, stretching is very safe. Now, I obviously wouldn't do the splits or, I probably wouldn't ride a bull. But as far as gentle stretching, exercise, aerobics, yoga, you should be fine. Like I said, I would need to see you specifically and see your hip specifically, but as a general rule, there's really very few restrictions after hip replacement. So you should be fine doing some stretching.
All right, do you have any other questions for our doctor?
No, I don't. I'm sorry, I'm having difficult bars with my friend's phone, but that was wonderful. I appreciate the information.
Thank you.
Thank you. So, over the years, I've had friends say, well, I got my left knee done and now I'm going to get my right knee done. They usually have a decent amount of spacing, but do you still space those out?
Well, years ago, we used to do what we call bilateral knee replacements. We'd do both at the same time. And they did a study years ago, and they found that people who had both knees done at the same time had 3 times the amount of complications of people who had them done one at a time. So in order to do both knees at the same time, the person's going to have to be like you. It's going to have to be a very healthy, active person with few comorbidities. So if somebody's older or they're overweight or they have diabetes or any type of heart disease, you have to be really careful doing both at the same time. And when you do both knees, it turns a relatively easy surgery into a much more complicated surgery. So if I do one knee replacement on somebody, they're going to come in the morning, they're going to get a regional anesthesia, they're going to have a knee replacement, which takes about an hour. They're going to go home. They'll be home by noon. And then they can do physical therapy at their house. They can have a nurse come to the house. They'll be walking around doing everything. They don't even spend one night in the hospital. However, if I do both knees at the same time on that person, it's much less likely they're going to be able to go home that day. And they might even have to go to a rehab or something. So it just turns a relatively safe, easy surgery into a more complex deal. So it's very rare today that we do both knees at the same time.
If both knees need it and you don't want to do them at the same time, what is the typical spacing between surgeries?
It's typically about 6 weeks. So we'll do the surgery, people go to rehab or go home and do therapy, and we'll see them back at 2 weeks. And usually at that time, we have a pretty good idea of where they want to do it again. So some people, everybody is different.
Yeah.
Some people, you do a knee, they come back at 2 weeks and they're like, man, I'm ready to go, let's schedule the other one. Other times they're like, I've kind of changed my mind, I want to hold off on that. So, it's really at their preference.
How have joint replacements changed in recent years?
Well, as far as the longevity, the new knee replacements, new hip replacements, they have better mobility, better strength, they feel more normal, they feel more stable. We have less of what we call, looks good, feels bad. that is where you get a knee replacement and you go back to see the doctor and the x-rays look good, your motion's good, but you just don't like it. It feels weird, or it feels unstable, or your strength is not what you thought it would be. So we used to have that fairly often years ago, and nowadays it's much more rare because we have robotics and we have very advanced AI that we're able to put the joints in very accurately. So when you're doing, especially a knee replacement, you're trying to hit a small bullseye with cuts and stability and motion, and everything has to be just right. And with the new technology, the AI, the robotics, I think we hit that bullseye much more commonly. As far as joint replacement goes these days, it's amazing. You know, I mean, I used to I've always liked doing joint replacements, but it was always kind of rough. You know, you would do it and you'd think, oh, you're going to have to go through a lot of pain. You have to do your therapy. But when you get out the other side, you're really going to be glad you did. So it's kind of like having a baby. So if you ask somebody right after they had a baby, it was terrible, I'm never doing this again. And then you ask them 6 months later, oh, it was a beautiful experience, I'm ready to have another baby. It's the same way with a joint replacement. But nowadays, we skip the whole, we're getting less of the pain and the struggle part. So it used to be, knees were notorious for getting stiff after surgery. You had to do a lot of physical therapy because they have a tendency to have trouble bending or trouble extending. And nowadays, if we get them done right and accurately, it's much easier. So the whole process has become much more pleasant.
I bet one of the biggest questions you get is, how long will it be before I can walk?
Immediately. I tell them you'll be walking an hour after surgery. Literally, after the surgery, we have usually use what's called a regional anesthesia. That's where you get a shot in the back and your legs get numb. It wears off in about 2 hours after the surgery. And then the physical therapy comes in there, stands you up, and people walk around and they go up and down stairs and they get dressed, and literally an hour after a knee replacement or a hip replacement. And most people, I say before surgery, I'll be talking to them and they'll be like, I want to spend the night. I'm like, well, you need to wait and make that decision after the surgery because you're going to be shocked. And they're like, I want to stay. Then after surgery, I come back in there, how you doing? They're like, I'm doing great, I want to go home. Mm-hmm. And it's people, for whatever reason, when you talk to friends, they always have a friend that had a joint replacement and it was very painful and they struggled and it didn't go well. But that's rare. I mean, I'm not going to say that there aren't people that struggle, but it's very rare. The vast majority of people fly through it and are surprised at how easy it is.
When someone is going to get a total hip or knee replacement, what do you tell them to do to prepare for it?
Okay, I tell them, get fit. You know, in fact, if somebody's really marginal, if somebody is struggling to walk, or they're obese, or their fitness and balance is bad, we will sometimes send them for physical therapy before surgery. Because you want to get that balance, you want to get that motion, you want to be as fit and as strong as you possibly can before surgery. And it's going to help you bounce back after surgery. So sometimes physical therapy before a joint replacement is more important and more useful than it is after the surgery.
So are there people who can actually cure their problems, for lack of a better word, by simply losing weight and going to physical therapy? Are there things you say, all right, before we go and do the replacement, I'd like to see you try A, B, and C?
Absolutely. I always tell people that joint replacement is the last item on the buffet. That is the last resort. So before then, you want to keep your weight down. Obviously, if you're morbidly obese, you're putting excessive pressure on your joints. And sometimes simply losing weight can take enough stress and pressure off your joints that they feel better. Exercise. And you don't got to run a marathon. You don't got to go do CrossFit. You can do some simple exercises with a physical therapist in your home, walking around the block. That's very important. there's a number of medications that we can give people that can help pain and inflammation. Non-steroidal anti-inflammatory medications are the most common. That would be ibuprofen, Aleve, prescription medications, meloxicam, Celebrex. We can do injections into joints. We can go to physical therapy. There's a number of things that we do first. Only when all that fails do we even present the option of a joint replacement.
All right, well, we have another caller. Nita, welcome to the program. What is your question for our doctor?
Okay, I would like to know, what is the weight goal for if you need a hip replacement?
Weight goals. Well, obviously, weight is an issue we have with people, especially in our country. And they've done a number of studies looking at people who are undergoing joint replacement, and they found if your BMI, which is your body mass index, is over 40, then your risk of complication from a joint replacement is about 3 times a normal person. So we really encourage people to get their weight below a BMI of 40. And a BMI is a calculation that you can do that takes into account your height and your weight. So if you're 6'5", you can weigh a lot more than if you're 5 foot tall. So those calculations go into it to determine it. But we encourage people to get their BMI under 40. There's a number of medications and things that can help with that. And there are certainly some people that just cannot achieve that goal for whatever reason. And sometimes their joints are so bad and they're not going to be able to get under 40 that we bite the bullet and do the joint replacement anyway. But they do need to understand that because of their weight, they are at higher risk.
There are so many weight loss tools on the market now too that we didn't have that long ago, with GLP-1s being one of them. So do you encourage people to try some of those types of things before going to the replacement option?
Yes, I am an orthopedic surgeon, which is basically a human mechanic. So I don't prescribe those things, but I'd certainly encourage people to, through diet, through exercise. And if they've exhausted those 2 options and have been unable to achieve their goal, then I recommend that they talk to their primary physician about some of the new aids that are available for weight loss, because I'm not an expert at that, but most people are able to achieve that goal. Sometimes it takes time. We talk to people in clinic and see you back in 6 months, work on your weight loss, and they come back and they've lost weight and we're ready to go. Sometimes they come back and they've gained weight. And at that point, we have a talk.
Yeah.
But I like to tell patients that we're going to be a team and we're going to work on this together. And it is complicated. And usually we're able to get to our goal, sometimes quickly, sometimes slowly. But we do want to do joint replacements safely. And weight is a big part of that.
And I would assume not waiting too long at advanced age. It's better to do it maybe in your 60s than your 80s.
Right. We see people with terrible arthritis, but they're struggling and they're getting by and they're doing their thing and they're in their 70s. And I'm telling them, listen, you're going to get a joint replacement. And if you don't do it now, you're going to be in your 80s and it's going to be complicated. So sometimes you do have to kind of take all that into consideration as to when you do it. But we do joint replacement on people in their 90s. I've done a 100-year-old.
Really?
Oh yeah, absolutely. I mean, when your option is a wheelchair or an hour-long surgery, which gets well in a few weeks, it's better, and most people, if you survive that long, you're probably healthy enough to do it. And the anesthesiologist today, I mean, how safe it is, no one's too old for a joint replacement.
All right, I have learned so much today. This has been fascinating. Thank you so much.
Thank you
for joining me. And thank you to all of you for joining us for Healthline 3. We hope you've learned some things today that will help you live a healthier and happier and pain-free life. We hope you'll join us again next time for Healthline 3.